thanks for joining us today. We're here to talk to you about donning and doffing and your personal protective equipment. Your personal protective equipment, or PPE, includes gowns, gloves, goggles, face shield, mask, shoe covers, and bonnets. First, we're going to go over the isolation cart, which has 4 drawers, and then we're going to show you how to properly don and doff all of your PPE.
In the top drawer, you will see your stethoscope, which is disposable. We'll have temp probes, which are also disposable. You'll have hand gel. And you'll also have isolation signs. Also located in there are Ziploc bags. In your second drawer, you will have masks. And you'll have large trash bags and your red biohazard bags and linen bags. And you will also have adult aprons and goggles. In the third drawer, you will find regular isolation gowns. In the fourth drawer, you will find extra large isolation gowns, which are great for your tall men or if you have broad shoulders. Next, we'll go over donning of your isolation gowns, which means to put on. First, you'll start with your gown. When you put your gown on, you want to make sure that you tie both ties at the top. Placing it over your head and around your waist. The next thing you will put on will be your mask. If your patient is in droplet isolation, you'll put on your surgical mask, but if they're in airborne, this will be when you put on your N95. If needed, you'll then put on goggles or your face shield. And that's depending on the type of procedure you're going into. And then last, you'll put on your gloves. For demonstration purposes, the gloves are in this isolation cart, but on the floors and on your units, they're all located in your room. And you'll put those on after you perform hand hygiene. Okay, now you're ready to go into your patient's room to take care of them. After you're done taking care of your patient and you're ready to leave your room, the steps of doffing or taking off your isolation are done in alphabetical order. So first you'll take off your gloves. Turn them inside out, dispose of. Then your face shield and goggles. Next will be your gown. Snapping it. There you go. Turning it inside out, trying to not get anything on you. And then last will be your mask. Remembering if you are in an airborne isolation room, you will come completely out of the room, shutting the door, and then taking the mask off then. And those are the proper steps of donning and doffing your isolation. Okay, we're going to show you a few what not to do's with your isolation gowns. As you can see, our models have their gowns not tied and they have their mask around their necks. This is not proper procedure, so we want to make sure that we have everything nice and tight and tied like it's supposed to. and our mask up and around our face like it's supposed to be. If you are pregnant, you may have to put 2 gowns on, one tied the other way around you to cover your belly. So they should fit all the way around, making sure that you're covered completely. Christina's gonna show you how to do that. All the way around. Just remember, every time you go into your patient's room that are on isolation, it's every time you go into the room. The proper technique to prevent contamination when doffing gloves includes pulling glove inside out with one hand, reaching with ungloved hand, rolling other glove off, then throwing both gloves away. Then when you want to take gown off, reach behind, pulling down, and then rolling it on itself into a ball, throwing gloves away. Then you will perform proper hand hygiene. To apply the N95 mask or the duckbill mask, you have 2 sides. You have the peach side, which is the top, and the bottom, which is white with the writing. You want to open the mask where 2 bands will fall out, making sure to separate. If you have long hair, you may want to pull it up into a ponytail. So you want to pull both bands over your head. One will go at the top and one will go at your neck. The band at the top you want to smooth and not pinch. You'll take a deep breath, performing a self-fit test, making sure that the mask collapses. All right, that's a self-fit test. In order to properly take off the N95 mask, you want to make sure you pull the bands at the back, not the front of the mask, capturing both bands. Pulling forward, and the mask will fall away. That's the proper way to doff the N95 or duckbill mask.